you for everyone to joining today's webinar, and a very welcome to everyone. My name is Dojan San, the research fellow at the University of Birmingham, and I'm very delighted to introduce today's speaker, Dr. Clare Tolley. So Dr. Clare Tolley is a pharmacist and a lecturer at the Newcastle University. She has interest in digital health and health services improvement research. She is currently involved in two large projects that are exploring environmental impact, like air pollution and temperature on health. So today she will present the findings of a large qualitative study that aimed to explore the public perspective around strategies to communicate the risk of air pollution to vulnerable groups. So, without further ado, I would like Dr. Claire to start the presentation. Claire, just like to know that you will have around 30 to 40 minutes for the presentation, and then we will have time for the audience question and the discussion. Yeah, and I will give you 2 minutes warning before the end of the presentation. So, Claire, over to you. Welcome.
Thank you very much. I'll just share the content slides now. Okay, I'm going to assume that everyone can see that, but do shout out if not. Okay, so thank you very much for joining today. I will be talking to you about a piece of work that we have done as a large part of a large collaboration as part of an NIHR funded program development grant. And this was kind of really centered around looking at what the optimal strategies are to communicate the risk of poor air quality through to vulnerable groups. So air pollution is a critical global health concern, and some studies have indicated that it causes around 4.2 million premature deaths every year across the world. And there was a report earlier this year, actually, over in the summer, published by the Royal College of General Practitioners, which suggested that around 30,000 deaths in the UK are attributed to air pollution, with estimated costs of over £27 billion annually. So we know that air pollution has a really diverse and wide impact on the body systems, and in particular, the smallest particles involved from air pollution can enter the bloodstream and from there travel across the body and have been linked to fetal development issues, cancer, cardiovascular disease, mental health conditions, and dementia as well. And the evidence also shows that air pollution is harmful to everyone. So there is no kind of safe level of air pollution, but certain groups are at more risk. And these include those with pre-existing health conditions, children, older adults, those from lower socioeconomic groups, and also ethnic minorities as well. So I think it's important to say that as part of kind of thinking about how we can tackle this larger, broader issue, I think it's important to state that the best approach is clearly to think about lowering air pollution from the offset. Okay. However, I think there's also part of it while we are living in, the current world that we are, that we need to consider about how we can inform citizens about the risk and actually promote that individual behavior change, which is where our project comes in as part of a much kind of broader strategy around preventing harm from air pollution. So there are lots of different ways and routes to communicate information about poor air quality. Things like smartphone apps, newspapers, television, public signage, etc. So we can get information from lots of different resources. But actually, from a bit of a background review around the literature in this space, we identified that the current air quality communication approaches are lacking, and in particular, they're unlikely to reach the most vulnerable populations, and there's not a lot of evidence to suggest that they actually result in really meaningful behaviour change as well. And lots of evidence is also calling for information to be tailored to groups that are most at risk or would benefit most from different communication and advice to enhance um, its relatability and understandability through more tailored approaches to reach them. So this is kind of where our project came from then. So we really were informed by the gaps in the literature and wanted to gain more of an understanding about individuals' perspectives around poor air quality and how we can communicate this types of information. So in particular, we wanted to understand what information individuals want to receive about elevated air pollution levels, when, where, and how they would like to receive it, and then teasing out kind of some of um, the barriers and enablers to this information. And then we also wanted to explore kind of co-production in its very earliest stages, really, of thinking about the content of different behavioral messages and what actions and actionable recommendations people would find acceptable, as well as be informed about any potential unintended consequences of these messages as well. And we were very keen to explore the role of or the impact potentially of digital exclusion, thinking about if a communication strategy was to use digital means as well. And we also wanted to tease out what people wanted from the local authority or infrastructure to actually help them and enable them to make changes. So, I guess before I go on any further, I'll just, I suppose, shout out to the fact that we had a really great PPI group involved in this piece of work right from the very initial stages. So we actually recruited 6 PPI representatives, and they brought different experience of having, living with multiple long-term conditions, different disabilities, caring responsibilities, also representation from different ethnicities, nationalities, and spoke additional languages beyond English as well. So I think this group were really crucial in terms of sort of informing the study, design, and helping us, conduct the study in a really meaningful way, to get the data that we did. We also had ethical approval to conduct this work from Newcastle University. So, in terms of our methods for this project, then we set out to conduct semi-structured interviews and/or focus groups with different participants across the Northeast. Um, we allowed or gave individuals the choice of participating in either semi-structured interviews or focus groups, depending on their individual preferences, um, and awareness of different needs, etc. Um, the region itself has got high rates of health inequalities. So, within the local area, we see huge variations in things like life expectancy compared to more affluent and less affluent areas that are really situated very close together in terms of distance, which makes it quite a nice an interesting kind of case study place to collect data from. Um, we used a purposeful snowball sampling approach, which was underpinned by a lot of extensive community engagement with different voluntary organisations across the Northeast, local community centres, religious groups. We hosted project information sessions and made a lot of effort kind of linking in with gatekeepers as well to understand the types of needs and preferences of the people that we were trying to engage in this piece of work. We also kind of provided information about kind of our professional background and our interest in the study, and then placed posters in various different places, public places, newsletters, and we ensured that these were translated into different languages as appropriate as well. So participants were then asked to complete a short expression of interest form where we collected some demographic information, and then we used this to inform our recruitment as well as monitor for diversity within our sample as well. And all participants were given a voucher as a thank you for their time. So I will just talk about the recruitment approach just a little bit more because I do think it was something that was a real strength of our approach. And we considered this very, very carefully as we were embarking on this study. And I think it really did enrich the findings that we got. So, we did the usual thing. We reached out to lots of different organizations, like well-established networks that are set up and are quite familiar with research. But we also thought about, how do we reach those people who are not already part of those networks as well? So, as part of this, we linked in with local council run schemes. So, in particular, the Employment and Skills Department within North Tyneside Council, who were providing digital skills training courses as well as language proficiency courses for people who were seeking work. And this really opened up a door for participants who I think wouldn't have otherwise been able to hear about the work and the research opportunity. Um, the other thing that we ensured was that we had interpreters in attendance as well, where required, so either from language interpretation or also British Sign Language interpreters as well. And that was for the recruitment and also the actual conducting the interviews or focus groups as well. So it was something that I've not previously done, but it was a great opportunity um, to have that chance to hear views from people that may have otherwise not been able to participate. Um, so yeah, I think our approach really helped recruit the people that we did, and I think there was a strong commitment to inclusivity throughout the work. So in terms of our analysis, so we used a two-phase approach here. So the first kind of stage was a inductive thematic analysis of the data, and then we performed a second phase of deductive mapping to an established framework. Um, and this framework was developed as part of an earlier piece of work that was based on a review of 37 papers. And this nicely developed sort of a wheel um, which of different dimensions about how to communicate air pollution information to change public attitudes and behaviours. So really closely aligned to the work that we were planning to do. And allowed us to kind of map the analysis that we had to these kind of more theory-informed domains. Okay, so in terms of our results then, so in total we recruited 50 participants, and as part of that, we had, I think, quite pleased with the diversity across the group as well. So we had 33 females, and we also had representation from young adults right the way through to older adults, which allowed us to get a range of different perspectives as well. A quarter of our participants had long-term conditions, sorry, and we also had representation of those with postgraduate qualifications. So a quarter of them, of the participants, did have postgraduate qualifications, but we also had representation. 1 in 10 of our participants had no qualifications at all. So showing, I think, that we were able to tap into a group that, really are often underrepresented in research. Um, yeah, and then I think to second that, we had, a large proportion of people who had never participated in research before, and over 1 in 4 of our participants was from a minority background as well. So here, I've got our kind of refined framework based on the analysis of our data. So our analysis generated kind of 4 key domains relating to kind of different components of an air pollution communication strategy, sorry, and then 19 sub themes or domains around that. And These kind of covered, I suppose, two distinct aspects. So on one side, we've got aspects relating to kind of communication around risks and harms, and then domains which more related to the attributes of that wider information system. So this include areas such as the channels that could be used and different features relating to that, the source of information and also the types of recommendations that individuals were open to being kind of being provided with. Okay, so things like wearing masks or avoiding polluted areas, etc. So I'll go into each of these in a little bit more detail now. So the first area I'll talk about is the domain relating to tailored information on risks and harms. So I think the data showed that there was quite a lot of discrepancy actually from participants around their understanding of air pollution. So while some participants, had quite a good understanding of air pollution and were able to discuss things like particulate matter, for example, and then the health impact of it, others were actually incorrectly referring to air pollution as a germ. They thought that children could actually pick up it and bring it home from school. So I think showing the disparity there in individuals is was really clear. Um, the other aspect was that, I think low awareness of air pollution and its health impact was broadly quite poor, and certainly not in the forefront of people's minds. So one participant, remarked that actually they lived really close to the A1, which is a major UK motorway, and they can literally see it from their window. They can see how busy it is, but they're not making that link between, the cars, the vehicles, the fumes, and the air pollution, and certainly not the health impact of it. Um, and I think ultimately this showed that there was kind of that lack of understanding, but across participants of all different groups, there was a real want for information about this and around air pollution and its health impacts. And they wanted to understand, the risk for them, and also in terms of their health and the broader environment as well. People were interested in that. However, we did come across kind of concerns around the risk of provoking fear. And people remarked on the fact that it could cause panic, particularly moving out of sort of a post-COVID pandemic. That was quite a big prominent feature of the data as well. And one aspect that came up around how to manage this or to mitigate this in some way was to think about how the messages were framed. So using positive framing, so stating what people should do or could do rather than what they shouldn't. So that kind of more that language is really, really important here. And then also thinking about when to message and balancing the risks and benefits of the communication in different circumstances. So some of the kind of key messages that came out about how we should actually communicate the risks and harms included things that people wanted to know, about these risks, yes, and they wanted that to be provided in a simple way, but not overly simplistic. Okay, so they did want to know things like the level of air pollution, and they wanted to be able to relate that. They needed they did want some detail about the information around air pollution. They also remarked on the fact that the information should be relatable and understandable. Okay, so they wanted to have information that was more tangible and use descriptions rather than being quite abstract, like high, low, medium, etc. So that was important. They also mentioned the value of having visual representations of risks, kind of using things, using different approaches in combination, but being mindful to avoid too much technical information. So I love this quote where a participant mentioned, once you start going into 97 particles per million, um, no one will have a squidgy what's going on, which just, was so true. And I've mentioned about the fact that if people wanted the information to be tailored, both kind of at multiple levels, actually. So tailored to them as an individual in terms of their health, where they were, and the area that was relevant around that air pollution, and actually based on the levels as well. So whether the levels were indeed high, medium, or low. And I've mentioned the positive framing to reduce anxiety. So we also kind of gathered insights around what people felt would be classed as an acceptable solution to take, and individuals wanted to be provided with a range of different options, and inclusivity was really important here. So I think what I did pick up from the data is that while there was generally lots of, uncertainty about what individuals could do, um, I think when we probed those that were from kind of more affluent backgrounds or more educated backgrounds were able to suggest things, that they could use filters, they could keep inhalers on them, and they could take different routes to where they were going, kind of in terms of journey planning, etc. However, there was a large proportion of people who really felt powerless. They didn't know what to do and actually thought that there was nothing that they could do. So I think that's quite powerful and shows the need to be able to provide some information that is inclusive. So some examples here of kind of different strategies that people did describe in a bit more detail. So we heard information about masks. This kind of was met with mixed views, although many people did kind of routinely wear masks and were familiar with them. There was kind of some barriers to that as well. Um, People discussed avoiding polluted areas, providing more education about reducing polluting activities. So things like idling cars, particularly around kind of busy built up areas and public spaces like schools. Um, and also they wanted individuals mentioned kind of they wanted to know more about how to get involved in um, local community initiatives, or actually be involved in lobbying for change with local councillors, etc. So I thought this was quite interesting to see within the data. Um, I think I will also mention, however, that there was some frustration towards local and national governments, and people provided suggestions, that they thought that these organisations could do more to actually support reductions in air pollution at source, as well as support individuals to make some of the changes um, that were, perhaps being suggested, like journey planning, taking certain routes, etc. Um, so I think this is something that people wanted to see more visibly, this kind of action that's been taken, partly because so that they didn't feel like this was all down to them as an individual and that the responsibility was shared. The next kind of domain I'll talk about was the source of information. So actually, where should the information come from? So we gathered lots of insights here around kind of individuals and who they trusted, who was classed as a trusted source of information. And I think in general, people trusted the NHS, or perhaps more particularly the healthcare professionals that they had a relationship with. Okay, so those that they maybe were being cared for and had already a good built relationship with. That was important. Education, that was really important. So people trusted educators right the way through. There's a role for kind of primary school education right the way through to kind of higher education. And also recognizing the role of public health bodies. And they really thought that these organizations should be doing more to promote kind of knowledge in this area, particularly around the risks of health, or the health related risks, sorry. Local authorities and government was an interesting one. And I think, there was variation, as you can imagine, in terms of people's trust of these organizations. It's highly politicized. So there was, some individuals that did trust, others that were more skeptical or cynical. However, I think to summarize kind of maybe the views, I think they were certainly, in terms of governments and local authorities, they definitely need to be part of the solution in terms of giving out information and part of the communication strategy, and be seen to supporting action initiatives in this area. Okay, and then kind of the fourth domain. So we looked at kind of the channel of communication. We found some sort of interesting data here around the timeliness of the message relates to the channel that is used. So if it was something that was kind of quite an urgent message or something that an individual needed to make a change at that point in time, so whether it was, high air pollution levels in an area, and they needed to maybe go a different route or not conduct exercise in that area, then people did want to be interrupted, if you like, and wanted that immediate prompt. Whereas if it was kind of less severe in terms of the air quality level, then there were people were interested in sort of a less obtrusive way of communicating information. So people talked about having apps or being able to navigate on websites to look and see what the air pollution was in certain areas and any recommendations about that. Um, SMS messaging was really interesting. So I think this was one approach that was actually really inclusive. So, I think all participants um, suggested that this would be a useful way to provide information. It was very accessible, and people remarked on the fact that they always have mobiles in their hand. And if, they want to check anything, they usually do it via their mobile phones. Um, in terms of other digital approaches, things like having an app, people were sort of on the fence. I think there was an interest in an app, however, that they could plan and use to inform their decisions or any behavior change. However, I think people were less inclined to download a specific app for this purpose, and it would be much better if it could be integrated into something that we're already using, for example, a journey planning app or a weather app, and then you could maybe have push notifications as part of that. What came across really strongly actually from our data was the role of community-based communication and peer education. And there was one participant actually who did not own a phone at all, and she explained how she got all of the information kind of about current affairs or things that she should or should not be doing, basically from her family. And I think you can see the role of that, particularly in of this form of communication channel around certain lower socioeconomic groups, ethnic minorities, or those with limiting conditions that may not be able to engage in other forms of communication as well. Um, and I think finally, the other kind of area that came up was around using public signage. So maybe having information in hospitals or community centres. And again, that the opportunity for that to tailor that to those that are actually in those areas. And then my final kind of slide to go through is thinking about the implications of this work. So I think what this data provides is an evidence and theory-based framework for communicating the health impacts of poor air quality, particularly focusing on the most vulnerable population groups who we know are also kind of at risk of other associated health inequalities. I think it's really important that these groups are considered. Um, what comes out quite strongly is the need for education around and communication on the risks and harms. And I think, we've identified some gaps around knowing what is safe, in inverted commas, air pollution levels, and that what is the impact of air pollution on health, and how to avoid harm where possible. And then we also need to think about the different routes that reach the most vulnerable individuals as well. So using trusted messengers, and I think there's a role here around healthcare professionals being really important, certainly public health bodies and peer supporters as well. In terms of the different actionable recommendations, we kind of have looked at the data, and there's evidence that protective actions must be acceptable, timely, feasible, and affordable. And I think these need to include strategies both at the individual and the societal level, in combination with support from local authorities and governments. And I think there's an opportunity here to really communicate the core benefits of actions. So promoting, you know, um, cycling, for example, as a mode of transport not only improves people's physical activity levels and the health benefits associated with that, but also has impact on reducing our contribution to air pollution as well. So I think some of this messaging could actually um, help promote some of these behaviour changes, and also and the impact of and knowledge around the impact of air pollution as well on health. And then finally, thinking about the channel, we're going to look at further research to explore, the role of SMS-based communication approaches and alerts to push out information, as well as thinking about the role of trusted messages. And then ultimately, there's a need to actually explore that end-to-end, process of the intervention and whether or not it actually does have an impact on behavior change, because I think that's much more harder to prove. But it's really important that we tease out that data as well. Okay, that is the end of my slides. So thank you very much for listening, and I'm happy to take any questions.
Hi, thank you. Thank you so much for your great presentation, Claire. Yeah, if you do have any questions, please just send that in our chat box or raise your hand. Actually, yeah, I do have one question, and I'm so interested in the framework that you just mentioned, that theory-based framework. May I ask, maybe, can you tell us a little bit more about the theories that underpin your project? Yeah, what kind of theories maybe you used for data analysis or trying to understand their needs or further communication strategies? Yeah.
Yeah, of course. So when we were planning the study, we developed the topic guide for the interview schedule and the focus group and kind of the broader study around behavioral change science. So looking at the COM-B model in particular, and using that to inform kind of the questions that we were asking, and then also that mapped quite nicely. So we did kind of that inductive thematic analysis to begin with. We didn't sort of use COM-B at the initial point of analysis, but the review that we did also did the review, the framework, if you remember, there was the first kind of wheel that presented. Um, that was also underpinned by behavioral science. So then we sort of mapped it to that as well. So it had that kind of strong behavioral science kind of theory underpinning the work.
Okay, yeah, I also remember that you mentioned some framing related things. So that kind of the theories from communication study, framing theory, agenda setting theory, things like that. Because I learned media and communication in my bachelor's and master's. So I'm thinking that focus on risk communication, whether certain communication related theories were used in this study.
No, I didn't actually, but no, it might be a nice thing that we could certainly look at. Yeah. I think in the larger review, I do remember there was yeah, I think there were reference to some of those aspects. So it may be that those theories have almost been sort of consolidated into that framework that we then mapped the data to. But yeah, it not formally as part of our analysis, although yeah, it sounds like it could have been a good thing to look at.
Yeah, yeah. Thank you. Thanks for answering that. Any other questions from the audience? Yeah.
Hi, I've got a sort of broader question, and that would be so who would take ultimate responsibility for sort of providing the data if this was rolled out on an app or whatever it would be? I think you mentioned a few different ideas for like whether it was a weather app or um so how would it sort of be transferable, I guess, across the country, and who would take responsibility for making sure that that was happening? And in addition to that, have you already spoken with those people, if it's local authorities who would be responsible or national government, like who would it be, and are they on board, I guess, is my question.
Yeah, so it's a really good question. I mean, this is some of the work that we're doing at the minute to explore these I suppose, avenues and where will it go and what will it lead to? So local authorities are definitely interested, and I think it's, green strategy is featuring on, within government so much. So I think it aligns with a lot of the policy that's out there. Um, we have been in touch with different different well, yeah, so it's local authorities who have partnered with oh, it's like Greater Manchester Transport Service, so it'll be kind of like bodies within local government, and I think there is an interest there around, for example, journey planning apps and actually having this as part of the information because I think people were really honest in the interviews, which I loved. They were like, "I'll never download that because I haven't got enough storage space," and I'm like, you know what? That's how we work, isn't it? It's maybe just another thing. Whereas actually, if you're using a commuting app and it's giving you information, but actually it happens to have that kind of logic behind it, um, then I think you could really embed it into the way that people do change. People are much more likely to change their behavior. So, yeah, I think there's work ongoing. We are also kind of looking at kind of work around the health service as well, because I think healthcare, and particularly reaching the most vulnerable people in terms of health background, I think is really important as well.
Hi, yeah, Heather, any questions?
I guess there's more a follow-on from Susan's point because things like the Met Office forecast, they do have the air pollution stuff already in there. And there is kind of like the DEFRA,
Yeah.
air link. And I guess it's more so thinking about not reinventing the wheel, and I think I was trying to look it up while Susan was talking, but like in Google, I know that there's things that you can kind of tick it, or is it the OS app? It's one of the apps that I use occasionally where it does include that information or it can get included in. So I guess it's a sort of thing. It's thinking then maybe that we have all these things and they're really easily available. And it's maybe just getting people to scroll down to see that it's there.
Yeah, for sure. It's really interesting because I got to put my hands up. I didn't know that that information was at the bottom of my weather app, and then now you scroll down, you say, "Oh yeah, air pollution level 2, 1." So it's quite interesting. You can see those things now, but I wouldn't have previously done that. Um, Now, I think what's interesting about because they have done a recent review of there was the air quality information system review, which looked at the scale that DEFRA is used. So there's been quite a big review around that, and I don't know. So basically, it was quite interesting. So our work was pretty much going on alongside this big review, and a lot of the findings are really complementary. So what we found is that actually the index that DEFRA use and it's pushed out through a lot of these apps, it certainly has a purpose, but it doesn't provide that more tailored kind of communication. And we've also, as part of this PDG, looked at predicting which groups are more at risk of different of the health impact of air pollution and using AI and modeling to help target who is most at risk as well. So um, I think looking at those pieces of work together, I think will be is kind of where we're thinking in terms of the next steps of this. We definitely don't want to reinvent the wheel, but I think there's sort of some more refining of maybe the existing tools, and particularly thinking about which routes are we not already exploiting probably as much as we should around peer supporters and healthcare professionals around vulnerable groups. Yeah. I can see one question in the chat, so I haven't read. So the what, how, etc. of messaging was really informative. Do you think anything you learned in terms of communication is specific to air pollution, or could it translate wider? Um, I mean, I think it's not a smart question. It's not a smart answer, but I think yes, it definitely could translate wider for sure. And I think yeah, in terms of communication around public health, I know there will be a huge amount of literature and best practice evidence around that. So I'm sure that there's certain things that, that we're coming up with. And that are not particularly new at that sort of high level maybe description. But I think what we've got is some really nice quotes and examples from the data about what would be meaningful from participants. So hopefully we'll be publishing this, and some of the richer data will help inform kind of, future interventions to come.
Yeah, I got one more. Can I ask one more question?
Yes,
I'm just
of
thinking
course.
about the vulnerable groups. Actually, I plan to do another research project focused on the minority groups, but I'd like to learn from your perspectives on how to say how you define those vulnerable groups, and did you include some people maybe face some social or economic disadvantages when I may miss some point, maybe you have already mentioned that, but I want to know more about, yeah, who are the vulnerable group people that you are targeted on, and any suggestions for me if I'd like to know more about this part of group. Yeah, thank you.
Yeah, absolutely. So we did so we had kind of a, there was sort of two different things that well, I suppose aspects that we were interested in. So there was those that may be more vulnerable down t uh, to the risks of poor air quality. Okay, so that like spoke to those from lower socioeconomic backgrounds for sure, that based around kind of residence, um, socioeconomic factors, etc. Um, there was also those with multiple long-term conditions, and yeah, so we kind of had, and yeah, and different disabilities as well. So we kind of had a group of in mind that we wanted to definitely be very mindful that we wanted to include. The other aspect was digital exclusion. So, because we were thinking around a potential digital tool as an intervention strategy, we wanted to make sure that we were capturing groups from who are known to be digitally excluded. And as part of the group, we have a research group. We have a PhD. Actually, she's got her PhD now. So, a PhD student was doing a piece of work on digital exclusion and did a review about which groups are most at risk. And within this came up with a framework, the CLEARS criteria. So it was those from different cultural backgrounds, and those with limiting conditions, educational status, etc. So there's a framework there. So we used this again to make sure that we had um, representation from those individuals who had multiple who represented multiple different groups, if that makes sense. Um, because we know of the power of intersectionality. So if you've got, one and two more of these, if you belong to more of these groups, then your risk of the health impact risk and also health inequalities is just so much greater.
Thank you. Thank you so
I'm
much.
very happy to help with the recruitment. I really enjoyed that part of it, and that's why I did talk a little bit about it in probably quite a lot of detail. But I really do think it took a lot of work,
Yeah.
but I do think it really helped us get people involved in a different way. We went in Christmas jumpers to a focus group and sat and took nibbles, with a bunch of people that like just wouldn't have otherwise got in touch with, you know. We came and joined like a little education session with them about something totally different. So it really did take time, but it paid off, I think, because they felt quite at ease to give their thoughts.
Yeah, thank you so much. I'd like to contact you maybe later.
Yes, that's absolutely fine.
Yeah, we can discuss more about that. Yeah, thank you so much. Yeah, Claire, thank you once again for your great and engaging presentation, and thank you everyone who joining us today. If there's no more question, yeah, I'd like to let you know that we still got another webinar that on Wednesday, the 17th December, but the time changed. That is 2 to 3 p.m. Yeah, if you'd like to know more about this webinar, Amy just post the link, and if you want to join us, and you can click the link for the network. The recording of this session will also be made available on the SPHR YouTube channel shortly. So yeah, thank you again for all your comments, questions, interactions. And thank you again for Claire's great presentation. Hopefully to meet you soon. Yeah, have a good afternoon. Thank you
Thanks
so
for having
much.
me. Cheers,
Good to
everyone.
meet you.